So when I see them, I have a number of treatment goals in mind. First, I want them to believe that they're going to be treated the same as everybody else, that it's not because they're workman's comp that they're going to be treated differently, for good or for bad, whatever they're thinking. You want to make them feel they're getting that best treatment. I really wanted to find the injury as fast as possible. In the knees, so many things can look like other things. A sprain can look very similar to someone who has a bad articular cartilage injury or a torn ligament injury. So I wanted to find the injury very quickly and put in place an action plan to define it. And usually that means getting an imaging study. And I know there are some people who will argue with me that I might ask for 3D imaging too quickly in the form of a CAT scan and MRI. But the prices now have dropped to less than $1,000 for a study. For a lot of these workers, that's a week's pay. And to help someone define what's going on and not go through 4 weeks of physical therapy unnecessarily to get a meniscus tear diagnosed later on, we basically, in the end, are actually wasting money not getting the MRI, even though a lot of these guidelines say you're supposed to not have symptoms for not have treatment for many weeks. We're going to probably get physical therapy pretty rapidly in there to work on the quadriceps. I hear that a lot today. And then you got to do this modified duty. I've heard it a lot from Andrew's talk and from the crowd, and it's really important. We know from perspective, work is good conditioning. It's great for mental health, and it's good for marital health too. So it's good for multiple reasons. So you got to treat everyone, okay? When you see these patients, you got to take a look at them. So you want to see them walk into the room. You don't want to, this person walks into your room, that person's functioning. That person has a torn lateral collateral ligament, and she's getting by. Okay, so she buckles, and she falls into so-called varus. And how is she surviving? Quadriceps muscle. She is strengthening herself. So you want to really look at them walk into the room and understand what's happening to them. And so we try to sneak pictures. In the hand world, Andrew can come in and has them do stuff. With me, I need to see them walk. So I like to be out in the hallway and make them do stuff. I like my office in Chestnut Hill where I can see them park outside and see how they walk differently from the car than they do down the hallway. It's a lot of fun. Okay? When you examine them, you want to look at their ligaments, examine their ligaments, look at how good their quadriceps is, see if they have any swelling, look for their alignment. She is straight when she walks on her other leg, and this leg is straight, it just buckles. So this is not a bony problem, this is a ligament problem. And then you want to palpate these people for tenderness. So you've gotten a good history, you've gotten a good physical exam on them, okay? And now you want to start getting some studies. X-rays, they're cheap, they're dirty, they give us what we need very quickly, which is nothing terrible is going on, and we can let them weight bear on it and start moving their knees, because stiffness is a problem with knees, and you don't want to let people get too stiff. So you always will get those. Most have already showed up in an emergency room, and so they will already have that. And then you want to figure out what imaging study you need. MRIs, they're great for soft tissue. They do not look at articular cartilage. God bless you. They do not look at articular cartilage real well. That is the weakness of MRIs. We often are surprised at arthroscopy what we find at articular cartilage. You have to sit someone in an MRI and get certain sequencing to get a better look at articular cartilage. And so the MRI centers, because it costs more times money for them, they often won't run them through quite as carefully. And even if you do a really good study, you often don't see it real well. Okay? CAT scans are great for fractures. They're good for bony anatomy. So if you've got someone with a clavicle fracture or of the shoulder, if you've got someone with a tibial plateau fracture, you're assessing healing, important to get that, or something you don't suspect is going on. It's a lot easier to see a fracture on the CAT scan. Fractures on MRI are very difficult to view. These can be expensive, but you've already heard my opinion about it. Get it, they're getting cheaper. You guys are getting the benefits from the workman's comp world of the managed care driving the price down of these things. So what are the topics we're going to talk about? We're going to break it into 5 different categories. I really liked how Andrew kind of broke each one of them down and had a session, so I'm going to try to remember, and I'm going to try to repeat the question as well. So please, you can all speak up, it's okay. So we'll start with meniscal tears. Meniscal tears are probably the most common thing I see from a work-related perspective, and it comes from people who get twists and falls. Often it's a hyperflexion injury. The patients will complain of pain, swelling. You really want to ask for mechanical symptoms. And the reason why I'm going to focus on this one is because if they have a sense of something getting caught in there or shifting in there, that really raises your antenna. You want to do a physical exam and look for joint line tenderness. You want to watch them walk or limp. You want to look for swelling. And here's a physical exam of the so-called McMurray sign. And that's this right up here. So the patient's asleep and consented, not feeling anything.